This is Ray, who took the foot and ankle and lower leg workshop taught by myself and a massage therapist, Larry Amos, in Denver, Colorado. And Ray has had knee pain for how many years?
Just since the beginning of this year.
Okay.
This horrible knee pain.
And what brought it on?
I think walking my dog.
Okay.
I got a new dog, got enthusiastic and started taking her for hour-long walks, and then my knee became excruciatingly painful.
Okay. And you had surgery on the hip?
Yes, I had been in a car accident 13 years ago. So
Okay.
I have that plate in my hip.
So we don't know what trauma really caused the knee, but we know that walking the dog certainly enhanced it.
Yes, that's
Okay.
where it came apparent.
Alrighty. So I'll demonstrate the evaluation, the most important findings of the eval, and I'll demonstrate how I did the treatment. But basically what I found was that your left knee did not bend as far as the right. And I found that the left knee hyperextended a little bit more than the right. And I found that the patella did not move laterally or medially. And when I tried to spring the femur posteriorly, it did not spring. And what I discerned by position and lack of movement and the gross movement test was that the distal femur was stuck in posterior glide. And we treated you for 5 minutes with me inducing an anterior glide force under the left femur and blocking the tibia. And I did that for 5 minutes. And after that, you stood up and walked around. Can you tell us how you felt?
When I got off the table, the pain was still a little bit of a glitch, but as I walked, it feels warm and non-painful. There's no pain now.
And there was pain before that when you walked?
Not while I was walking. Yeah, before I walked, yes. As I got off the table, it gave a little bit of a
so
glitch.
when you walked at lunch, was the knee painful?
Yes,
So it was always painful when you walked?
yes,
Okay. And so now you can walk without pain?
without pain, yes.
Okay. Well, I like to bring attention to this dysfunction of the knee because it's a positional dysfunction. It's a motion dysfunction that requires a very specific treatment, but responds beautifully. And like I said, it's a one-time treatment. Okay? And I'm in town. You know where I am. If you ever need it treated again, you know how to find me. But again, it's a one-time 5-minute treatment. And so I'm going to turn the camera over to Larry, and I'll just demonstrate some of the findings and the treatment technique.
Okay.
So let's have you lie on your back, please. We did a side-to-side comparison, and the left patella was stuck. I could not move it left to right, but on the right patella it moved very freely. Looking at position, this femur was visibly posterior, more posterior than the other, and it didn't have mobility when I tried to spring it. Of course, now I can take up the slack and I can spring it. You had greater extension of the knee on the left. I could lift this heel higher than the right heel, but you had a reduction of knee flexion comparing to the right side. And so my conclusion was that the femur was stuck in posterior glide relative to the tibia. It's a small amount of motion, but it's a very important motion. And so what I did was I snaked underneath the left femur to create an upward lift, but then with my left hand I blocked the tibia and I maintained a steady lift for 5 minutes. And after that, in response to that treatment, and I would add that during the treatment after about the 3rd minute, she described what she felt was a lengthening of the leg. And what else did you feel? Anything else while I was treating you?
Yes. That it would contract and then release.
Okay, very good. And so after 5 minutes, I then came off of it and found that we could take up the slack and spring it. I had normal forward and movement and recoil. Patella was much freer. We tested knee flexion. It was greater, and we tested knee extension, and that was about the same as the other side. So in some directions we gained motion, in others we reduced motion, bringing her back not to an external norm, but to her norm. We brought this knee to function same as this knee. So it wasn't an external ideal, it was based on your body template. And I'm pleased with the results. And
so am I.
good. Anyway, so once again, this was a posterior glide fixation of the distal femur. Very simple to test for and very simple to treat. Thank you.